And now let's get to know more about these new COVID-19 variants with OCTA Research Fellow Professor Guido David. Good morning, Professor. Welcome to the program, as always. Now, tell us more about these new subvariants, Omicron, XBB, and XBC. What do we know about them?
Yes, hi, good morning, Ria. And as mentioned by your reporter, Carolyn, the XBB is a variant or Omicron subvariant that's actually a recombinant of two Omicron subvariants. And we have been monitoring this for some time because we are seeing a rise in cases in Singapore. And actually, it is definitely more infectious than the BA5 because the case rise is, it's quite fast compared to the BA5. So in Singapore, it's projected to exceed the wave accounted for by the BA5. So it's more transmissible, and it also has more immune escape. So that means that even if we have been previously infected with, let's say, Omicron, it does not guarantee that we will have immunity against the XBB. Now, we have been monitoring the XBB, but the XBC is actually quite new. And, I've been trying to find data on that. And even the UK just indicates it as a variant of interest. And what's surprising is that there are already 5 deaths reported with this XBC. And the XBC is a recombinant of Delta and Omicron. And if we recall, the Delta variant produced more deaths and more hospitalization. So if it has the features of Omicron, the infectiousness of Omicron and the immune escape of Omicron, but the other characteristics of Delta, it could be a concern. We're not jumping to conclusions right now, Maria. We're still monitoring the data, but we're just saying that there is some uncertainty about this XBC subvariant.
Right. When you say that it comes from the Delta variant, that does seem a bit concerning. What do we know about the symptoms that these new subvariants produce?
Well, looking at, for example, the XBB, we do get this some of the same symptoms, like flu-like symptoms, that could include fever, but not necessarily with fever. It could have a sore throat, runny nose, coughing and sneezing, body aches, body pains. But there seems to be new presentations that have been identified with, at least with XBB, and that includes nausea, vomiting, and diarrhea. And in fact, we did mention this last time we talked, that there could be vomiting and diarrhea as symptoms. So definitely, it may not feel like the previous, COVID variants that have raged the country, but there could be additional symptoms that we haven't, seen before.
Right. It's still early days for these subvariants. But, let's talk about what's happening here at home and what we expect to happen. There's been upticks in countries overseas, as was mentioned, Singapore, the UK, even the US. Now that we know for sure these variants are here, are we expecting an uptick? How big and when?
Well, actually, Ria, we have been puzzled over the past months about, the increase and decrease in cases. And we did notice significant, uptick in cases in Barm region and in other parts of Mindanao. So we may attribute some of these upticks that we have seen already to some of these subvariants, but we're not sure, because there's not a lot of detail on where these subvariants were identified. Unfortunately, we're not really testing as much as we were even back in January. So the caseload may not reach higher levels or significantly higher levels, but it does not mean that it's not spreading in the country. We could see maybe 3,000, 4,000. With the current testing that we have, I doubt that we'll see more than 5,000, but it doesn't mean that, it's not a concern. In other countries, like in Austria, some other subvariants spreading there, and they're seeing a rise in hospitalization. So it could definitely happen that we could see an increase in hospitalizations due to these subvariants. We're not again, we're not jumping to conclusions. We're just saying these are possibilities at this time.
Do you think we need to do more testing? Is that something that you would suggest? So here in the country, we get a better picture of what's really happening.
Yes, Maria. I think we could do something similar to what we did back in January when the DOTR did random antigen testing. Most antigen tests don't get reported to the central database, and this sort of makes the numbers decreased, or we're not really seeing the clear picture about the numbers. And we understand that RT-PCR testing is more expensive, and it takes more time. Mm-hmm. But at least if we have random testing, just like what we had in January, we will have a better picture.
Right. So far, the government has said it's status quo. They're not going to change anything for now. But do you think the government should bring back tighter restrictions now that these variants have reached the country? Is there a need to put tighter restrictions on our country's borders?
Well, I don't think that would be of much help at this time, Ria, because the virus are already here. And they might already be in transmission. So, I think we could be more vigilant about our health protocols. We need to, we need to have more people getting booster shots. And I agree with what was said, that the bivalent vaccines, I think it was said by Joey Concepcion, that the bivalent could be very useful because in some other countries, they found that data showed that the bivalent offers more protection against these new subvariants because, as I mentioned earlier, prior infection does not guarantee immunity because these new subvariants have high immune escape. So getting more vaccines, as you mentioned, getting more testing, being more vigilant with our health protocols, even if it's optional, I think we could, recommend or advise the public to strictly follow the health protocols.
Now, if we were to make bivalent vaccines available, as was suggested, what's the time frame for that? How long would it take?
Well, unfortunately, I mean, I'm not familiar with the process, Ria, and I think it has to go through, an approval system, with the EUA, with the FDA. So it might be, next year before we see these bivalent vaccines, in our country. It could be like January, February. The wave might be over by then.
Right.
But of course, there might be other variants in the future that may come in. So I'm not sure. I know some people have gone to the U.S. and gotten bivalent vaccines. So sana all.
Indeed. Thank you so much for speaking with us this morning. That was OCTA Research Fellow Guido David.